Welcome back to another episode of What Can We Get Into? This week is a solo episode. We've had a few guests on thus far, and this week I'm going solo to explain some of my favorite things. If this is your first time listening, I'm Dr. Brown. I'm a chiropractor in the great state of Texas. Dallas, Texas is where my office is located. I'm the owner and founder of Texas Spine Center Chiropractic. I want to jump on here today and I want to talk about inversion tables and if they are good or bad for your spine. I get that question asked quite a bit, so let's dive into it. So an inversion table, for those of you who don't know, is basically a table where you can flip yourself or invert yourself upside down. And you may ask, why would that be good? So it's good because it takes you out of gravity. A lot of spine problems originate from compression-based issues, whether they're old injuries, car wrecks, sports traumas, sitting at a desk all day long, those types of things. They're going to start to compress your spine. And a lot of people will make the phone call to come see me when they've got compression on the discs, or more importantly, compression on the nerves. And we're going to get into a little bit of how that presents and why an inversion table can be a good thing or may not be a good thing, getting through the details of what's going on a little bit. So the first thing a couple things we need to understand and be on the same page about are the anatomy of what's happening. So in the spine, we have vertebrae. So basically you have bone and a soft tissue in between called the disc. It's like a shock absorber. And then you have another bone underneath it. That's basically what's happening all the way from the top of your neck down to your sacrum. So that little tissue in between that we call the disc, that is what's going to cause the majority of problems for the patients that come and see me. So that disc will start to compress. That's not really why you're going to pick up the phone to call a chiropractor. You're going to pick up a phone to call a chiropractor and start looking for things to do when that disc bulges out and starts to press on the nerves. I always tell patients, you're really not going to have a lot of pain with just a disc that's compressed a little bit. However, once it starts to compress out and hit the nerve, that's when you're going to realize, oh, I got to do something about this, right? So back to the inversion conversation. How does an inversion table from a 30,000 foot view help this type of condition? Well, very simply put, you have a compression issue. The disc is compressed. It's pushing on the nerve. An inversion table is going to help pull you out of gravity and start to create some negative pressure there. Good for most people, but it may not help everyone. Here's the caveat. If you hurt your back on Sunday and it's Tuesday and you quote unquote threw your back out, you may have a lot of compression on a nerve. Your muscles may be in spasm. Your body's trying to protect itself. It's very smart. Your body will start to protect itself. So what your body may not like is flipping upside down to try to get that decompression or that inversion because it doesn't really fully understand what is going on basically. So it's going to keep you in spasm and not allow that to happen. So a lot of times what I'll tell patients that have an acutely compressed or even a chronically compressed nerve, you want to start out by doing some stretching and some mobilization, a lot of times from a chiropractic adjustment. And one of the main things that I'll do in my office is an adjustment followed by some decompression. So a decompression table is going to do just that. It's going to decompress the spine with two variables. One of the variables being the location it pulls at. So if you have a compressed disc in your neck at C6 and 7, that's radiating pain down your arm, I want to target that C6 and 7 and pull very specifically at that joint. If you're on an inversion table, it's going to pull the entire spine. It may not be able to target C6 and 7 enough. And the same holds true for the lower back. L5S1 is 84% of the disc injuries that walk in. I want to target that. If you walk in here with very acute lower back pain or maybe chronic lower back pain that's coming from one specific segment, you're going to want to target that segment, get out of pain, get out of relative discomfort, and then use the inversion table. See, the inversion table is a great maintenance piece. I talked about the two variables of the decompression table, one being where you pull. That won't change much from treatment to treatment. how hard you pull will. So it's kind of like a workout. So you'd start at, for the lower back, say 60 pounds of pull, targeting L5S1, for instance. And then you can start to increase that each time. Say you go 60 pounds, then 70 pounds, then 80 pounds. Getting more and more pull, you'll get more and more relief. You'll get less and less axial, AKA pain around your spine. And a lot of times you're going to get reduction in the radiating pain down your arms or down your legs, AKA the sciatica, the shocking, shooting symptoms that come with a compressed nerve. So once you have that decompressed, then you want to move into mobilizing at home through stretching, through strengthening, and doing some inversion table at home. So how do you do that, you might ask? Well, hanging upside down is just kind of flipping it upside down is not a bad idea, but it's not the best protocol in order to target, for instance, your lower back. Most common thing to happen in my office is lower back pain. So how do you target that? Well, there's a few variables. One is you want to get on the table at neutral, we'll call it horizontal, and you want to lock your feet in and set the point at where it teeters to your height. That's very important. So you want it to make it very hard to go down, easy to come back up. So that's the first thing. I don't want you worried about getting stuck on it, because that's a very real worry most patients have, is getting stuck on it. So the harder you make it to go down and the easier you make it to pop back up is really going to be beneficial here. And I'll explain to you why that's beneficial with the protocol that I have that helps with this. So that's step one, is set it to a good height. Once you're on it, you actually want to set the pin. There will be a pin to stop you so you don't go any further, so you don't fully go upside down, at about 60 degrees. So for the lower back, 60 degrees is the best point to get as much pull directly at the lower back as possible. So start at horizontal, set your height, go down to 60 degrees, and you're going to stay there for about 45 seconds. So I want you to get an app on your phone that does interval timing. You're going to go down 45 seconds, stay down there, and you want to come back up to neutral, horizontal, for 15 seconds. And you want to repeat that about 5 to 10 times. You can do that daily. You can do that a couple times a week. I would say it depends on the severity. You know, if you work a very intense job, daily is not a bad idea. If you're a desk jockey, meaning you work at a desk all day long, I like, 3 to 4 times a week. Even once a week's okay, depending on the situation. But that's how you're best going to use an inversion table to help maintain your lower back condition. It's probably not going to fix it when you have an acute episode or something chronic that's never been treated properly, but it's a great way to maintain. And I'm going to touch on one more piece here, and that's stability. I talk a lot about stability versus mobility. I just put a video out on social. You want both. So you don't want to be too mobile, meaning you have very strong mobility to where you're too flexible. Because what happens is if you pull that joint apart, there's nothing holding it there to prevent it from going right back to compressed. And you also want stability. So that's on the other end of the equation, is stability. You don't want to be the muscle guy with too much strength and stability that can't move around, because that's going to provide you just as many problems as being too mobile. So you want the mobility with stability. I like exercises that are yoga and Pilates based. There are a lot of isometric, meaning holding exercises, to help achieve this. It doesn't have to be your whole routine, but once or twice a week, incorporate some holding based core, glute, lower back activation, because that is going to help you increase stability. A lot of people on MRIs that I see around the spine have weakness. Now, whether that's from an imbalance of working out or sitting at a desk all day long or just being seated, a lot of people have instability around their spine. So what happens is if I pull or adjust a patient, decompress a patient, or even you do some inversion at home and it's not helping, it's not lasting, or it may be even making it worse, you probably have some instability in that joint, which is not allowing that joint to fully stay decompressed with the effort you're making. So doing some of the exercises I mentioned prior, the yoga and Pilates and isometric, aka holding exercises, are going to be something that helps quite a bit. So I just wanted to hop on here, do a quick little solo podcast, talk about how doing some of these things at home are good, but they may not always be good as your first line of treatment in these sort of conditions. The way that I'd go is, for the first 30 days, we're going to work a lot in my office, working with mobility, stability, and also doing some decompression and adjustments. And then as that person starts to graduate and feel better, then we put more on them at home. And that's really the protocol and how you maintain these types of conditions to where they don't become a recurrent every quarter, every week, every year condition. Next episode, we're back to having guests on here. I got some fun guests coming up. We've got Victor, who owns a coffee shop here in Dallas. I've got a neurosurgeon coming on soon. I've got a guy named Ed Bullion, who's a big car YouTuber. So not only health and fitness and exercise and pain-based chiropractic podcast here. We've got all kinds of stuff. That's all I got for today. I look forward to talking to you soon. Over and out.